We're going to do a little bit of filler in her nasal labial folds here, which is the most common place. Everybody has this done. And Miss Kim, when you sit down, move your forehead up and down. Miss Kim doesn't have a lot of, go ahead and do that again, you know, lines on her forehead. But if you come back and see Kim in 2 days, she won't be able to move her forehead. We'll get rid of all of these. So we're going to put a little bit of Botox in her forehead, and then we're going to put a little bit of something called Juvederm Ultra in her nasal labial folds to flatten them out a little bit. Okay, so first thing we're going to do here with Miss Kim is clean off makeup. I know she wore makeup, but the problem is you can actually pull the makeup through, you know, when you put the filler in, and it can actually leave a little foreign body like a tattoo. And number two, you don't want to pull any bacteria through either with it. And Miss Kim here, we're going to start right over here, and we're kind of in the middle of her eye if you look, and I am going to leave a little bump if you take a look. And I'm going to massage it a little bit, but I never let patients do that because you can actually push the botulinum toxin where you don't want it if you don't know what you're doing. And there may or may not be just a little drop of blood here, and Miss Susie here is going to put a little bit of medication on that. Botox, if it's done right and you hit the muscle, the frontalis muscle here, it has a burn. If it doesn't have a burn, you're in the wrong spot. You know, it didn't do any good anyway, you know, at that point. Okay, we're going to switch gloves, and we're going to clean up her nasolabial folds here and put a little bit of filler in. The fillers that I like the most are up here. Actually, Radius isn't, but I like Radius too. But I like Prevail Silk. The Juvederm products, they have a couple of them. They have a Juvederm Ultra and a Juvederm Ultra Plus. And the difference between Juvederm Ultra and the Ultra Plus is they put anesthetic in the Plus. So when you're injecting it, it's a lot less ouchy, especially if you didn't pre-numb up the patient. Let me give you some pluses and minuses why you do or don't numb up a patient when you're doing a filler. If you put the anesthetic in, it distorts the anatomy ever so slightly from the fluid, from the anesthetic, and you're not quite as precise, you know, when you put the filler in. If the patient's able to handle the filler without the anesthetic, I tell them to do it. Okay, and ask him when we're done here whether or not she thought the Botox was more ouchy than this, which it does have a little anesthetic in it, by the way, but I still didn't numb her up, you know, to do this. All right, we're gonna have her just tilt her head back just a little bit. And with this particular product, I do usually have to put my thumb or my index finger in the mouth to make sure I know it's going exactly where I want it to go. Kim, open your mouth up just a little bit. Do I get bit often? I have been bit twice.
So does this have any anesthesia?
This one actually does in it. The problem is you still have to stick up, you know, put up with the little needle stick when we're doing it. Okay, now be honest with him. How was that? And by the way, remember what I said. This is actually kind of a large bore needle, you know, that we just used on her. So.
The filler is worse than the Botox here. It hurts less than the dentist. If that gives you the dentist.